Refractory chronic cough, a persistent cough lasting more than 8 weeks that remains unresponsive to guideline-based treatment, is increasingly recognized as a disorder of sensory nerve dysfunction driven by abnormal signaling along the cough reflex pathway. In cough hypersensitivity, the neural threshold for triggering cough is lowered. Everyday stimuli, such as cold air, fragrances, or speaking, reach both normal and hypersensitive nerves, but only the hypersensitive nerve crosses its threshold, generating an exaggerated urge to cough. The cough reflex begins in vagal afferent sensory nerves within the airway epithelium. Chemosensitive C fibers and mechanosensitive A delta afferents can become hyperresponsive, lowering the threshold for cough triggering and amplifying sensory signaling toward the brainstem. Cough signaling is driven through two converging pathways. External irritants activate TRPV1 and TRPA1 channels on sensory nerve terminals. Simultaneously, airway injury and inflammation trigger release of extracellular ATP, which binds P2X3 receptors on the same nerve fibers, amplifying the signal that drives the urge to cough. ATP binds the trimeric P2X3 receptor, a ligand-gated ion channel on vagal afferent nerve terminals. The channel pore opens, allowing sodium and calcium influx that depolarizes the nerve. In cough hypersensitivity, ATP P2X3 signaling can become amplified, increasing the neural drive behind the urge to cough, making P2X3 a compelling therapeutic target. These amplified afferent signals travel along the vagus nerve to brainstem cough centers, where they can overwhelm normal inhibitory control and reduce suppression of the cough reflex. A key peripheral contributor to this drive is ATP P2X3 signaling on vagal afferent nerve terminals. P2X3 antagonists interrupt this process at the source. By binding allosterically, they prevent ATP-gated channel opening and stabilize the closed state, reducing sensory signaling and dampening pathological cough reflex activation. With peripheral P2X3 signaling blocked, the hyperactivated cough reflex pathway normalizes. The vagus nerve quiets, brainstem cough centers return to baseline, and the pathological drive to cough is interrupted. Clinical studies show that targeting P2X3-mediated signaling can meaningfully reduce cough frequency, establishing P2X3 antagonism as a foundational therapeutic strategy for refractory chronic cough. P2X3 antagonist, targeting sensory nerve hypersensitivity at the source.